Hello and welcome. Today, we are going to be looking at peptic ulcer disease. It is a quite common condition affecting a significant percentage of the population. The symptoms could be quite distressing and it is difficult to manage and can result in devastating complications. I am Dr. Igenbai Cyprian, and this is Inside Health.
Lenva Antibacterial Sanitizer Spray.
Welcome back. Peptic ulcer disease gets its name from the fact that a hormone known as pepsin has been implicated in the development of this condition. And this ulcer can be in the stomach, where it is called gastric ulcer. It could also be in the duodenum. This is the first part of the intestine that leads from the stomach. And the symptoms of this condition include pain or burning sensation in the upper part of the abdomen. In the case of stomach ulcer, this pain occurs immediately following a meal or while you are eating. If the ulcer is in the duodenum, which is the first part of the intestine, it occurs few hours after meal. And this is the kind that would wake one up from sleep. What causes peptic ulcer disease? Naturally, in the stomach, there are factors that are described as aggressive factors. You understand that the stomach produces hydrochloric acid, and this acid is necessary to initiate the digestion of protein. And this is one of the factors that causes stomach ulcer. There's also the hormone pepsin, and there are other factors like the bile salts and bile acid. These are aggressive factors that can lead to the development of ulcer. There are also some other factors known as the protective factors. These factors protect against the effect of the aggressive factors just stated. These include a mucus layer that lines the stomach. This mucus layer protects against the direct effect of acid on the stomach lining. There are also cells in the stomach that produce bicarbonate. Bicarbonate is an alkali or a base, and this effectively neutralizes the acid. And there's also a rich blood supply that ensures rapid turnover of these cells that line the stomach. There are also some factors like cellular restitution that are beyond the scope of this discussion. So ulcer would result when there's an imbalance between these aggressive factors and the protective factors. Peptic ulcer disease represents a progression from a spectrum of diseases starting from gastritis, which is inflammation of the stomach lining. It progresses to gastric erosion. When the ulcer, which is a defect in the stomach lining, gets to a particular depth, it is then described as an ulcer. But all these conditions have similar symptoms. One of the factors that will cause an imbalance or an increase in the aggressive factors and thus contributing to the development of ulcer is the use of NSAIDs. NSAIDs is an acronym that stands for non-steroidal anti-inflammatory drugs. These drugs are commonly purchased over the counter for treatment of pain, and they include drugs like ibuprofen, diclofenac. These drugs cause ulcer by inhibiting the production of a substance that helps to protect the stomach lining from effects of acid and other aggressive factors. Also, there is a bacteria known as Helicobacter pylori. It is present in about 98% of individuals with stomach ulcer. So it has a role, it plays an important role in the development of stomach ulcer and also puts one at risk of developing some form of stomach cancer if not eradicated. Another factor that will cause an imbalance between the aggressive factor and the protective factor is the use of spirits. Spirits would wipe off the protective mucus layer similar to the way a thinner would wipe off varnish or paint, thereby exposing the stomach linings to the effects of acids and other factors. Also, smoking would also put one at risk of developing stomach ulcer. Smoking reduces the blood flow to the stomach, thereby reducing the ability of the stomach to quickly replenish any damaged cells on the linings, putting you at a risk of developing stomach ulcer. The use of steroids also puts you at a risk of developing stomach ulcer. This list is far from exhaustive. Stomach ulcer can lead to some devastating complications, and some of these are worth mentioning. The ulcer can erode into a blood vessel, into an artery, and can lead to torrential bleeding. The patient can go into shock and can even die from this bleeding. The ulcer can also perforate, putting a hole in your stomach or in your duodenum, and this leads to a devastating complication known as peritonitis, which is increasingly fatal. It can also lead to a condition known as gastric outlet obstruction. Gastric or gastrum is the stomach. So the stomach, if the ulcer is towards the exit of the stomach around the duodenum, it can heal with scar, with fibrosis, thereby constricting the outlets of the stomach. And this has its own symptoms. It's quite a devastating complication. Stomach ulcer, if left untreated, can also undergo what we call malignant transformation that can result in cancer. For these reasons, it's necessary that you visit your healthcare provider if you have any symptoms that might suggest peptic ulcer. I am Dr. Igenegbai Cyprian. This is Inside Health. Until I come your way again, don't forget, practice social distancing, use your face covering, practice hand hygiene, stay safe. I'll see you next time.